Hi, ladies and gentlemen. It's Dr. Novoa. Today's question and comment has to do with a major problem or complication associated with the use of meshes. Now, many of you that follow me in the subgroups, one of those subgroups happens to be related to hernia meshes and also vaginal meshes or rectal perineal meshes. One of the major complications related to the use of meshes is something that's actually expected, and that is the foreign body reaction. Now, we as doctors intuitively think that the use of a mesh is supposed to help a situation, but because doctors are not well versed in how meshes are made or what they do to the human body, we're clueless on how to manage the complications of meshes and pretty much any foreign body, as I've explained it over and over and over again. But here's the main thing with hernia meshes, vaginal meshes, and rectal perineal meshes. If you run into a problem with one of these things, it is a nightmare for that patient for the rest of their life, pretty much. And that is something that is not commonly discussed prior to the placement of a mesh. In so many cases, if a patient were told, hey, listen, if I place this mesh in your body, you could have a catastrophic outcome, which I can't fix. If you said it in plain English just like that, I'm sure a significant number, if not the majority of patients, would just rather deal with the problem that they have. If they have a hernia that's, bothersome, a little bit uncomfortable sometimes, but it's tolerable, they would probably say, you know what, I'm fine with that. If you're telling me that you're going to repair this with a material that can cause me catastrophic problems in my future, and that you may not be able to fix if there is a complication, I don't want that. I don't want that in my body. No. For ladies, for vaginal meshes, if you were told that you would have chronic pelvic pain, the inability to walk, and the inability to have sexual intercourse for the rest of your life if there's a complication with this vaginal mesh, I think the vast majority of women would say, you know what, I don't want that in my body. Not at all. Not at all. And if for rectal perineal meshes, if you were told that it could erode through your rectum or erode through your intestines and you would need a colostomy for the rest of your life, I think the vast majority of patients would say, you know what, I don't want that in my body. I would rather deal with a prolapse. I would rather deal with pressure than for you to tell me that you might have to disconnect my bowels, and then I'm going to need a colostomy for the rest of my life, or that this thing could not be removed and I'm going to have chronic pain for the rest of my life. So I was reading up on a serious complication, and I posted related to this to the problems with this hernia. Now, again, fundamental problem. If you run into, first of all, a significant number of hernia meshes will get infected, more than 20%, at least 5 to 10%, sometimes as high as 30% will get infected. Once a mesh gets infected, it needs to come out. And in many cases, a mesh can't be taken out. So for vaginal meshes, they're expected to get infected because they're going to erode in many cases through the vagina, and then the vagina is a plethora of natural bacteria, and it's going to get the meshes infected. But we're talking about an abdominal hernia mesh in this story. So once a hernia mesh gets infected, it's practically impossible sometimes to properly remove. But here is a comment that I read in the article by the physician or the group of doctors that wrote this article. Quote, "It is challenging for an ordinary surgeon to be up to speed with the latest evidence-based practices if dealing with a surgical domain not practiced regularly. Boom, that's what I'm talking about. If you're talking about complications related to breast implants, Essure, Felshie clips, surgical clips, hernia meshes, vaginal meshes, vertebral implants, we as doctors are trained on how to place these devices in your body. But we as doctors, in many cases, are clueless on how to remove them. Worse, in many cases, doctors feel that they're qualified to go in there and remove these devices without any practical experience on how to do so, leading to further complications or making the situation worse for the patient, in some cases requiring multiple surgeries with doctors with just as much or as less skill, less experience with dealing with these complications. There's only a finite subset of truly gifted, truly skilled doctors that have the level of experience to properly remove meshes or properly remove any foreign body. And here's the catch. Again, we're talking about informed consent. If you go to a doctor who tells you that, hey, this is easy to place, first question, how easy is it to remove? If you have a complication, if I have a complication, how easy is it to remove? And what is the quality of my life going to be like after you remove it? Please, ladies and gentlemen, if you're going to have any foreign body placed in your body, especially if you're going to have meshes placed in your body, hernia meshes placed in your body, the first question you ask is, if I have a complication, are you, as my doctor, qualified to remove it without without there being significant problems for me or making my situation worse? If the doctor cannot answer the question, which we can't, if the doctor cannot answer the question and tell you, you know what, if I put it in, I can take it out, and if I take it out, it's not going to be any worse than when I put it in, you should seriously consider not having the mesh placed ever. Ever. That's my comment and question and comment for today. Thanks so much for watching. Take care.